Cannot stay in business with the amount of money they have to spend on these health aspects. Now, I already feel it. Oh, I feel it. It's coming. It's coming. But Teresa, that's a personal responsibility. How many of you are thinking that right now? How many? I'm not psychic. I know I was psychic. I know you're thinking it. It is change that discussion. We are those little lawyers coming through the door for the first time, kind of like those little dudes who came and talked to you about return to work and you all scoffed them off. It's okay. Go ahead, scoff. It's all right. But the fact is we are trying to change that. We're trying to change that discussion. I want you to start thinking about that. Wow, what can happen? What can I do for my own health, for my own? What can I do for my safety committee and my wellness folks? How do we change that discussion from health being the absence of disease? Think about that for a second. If I were to have asked you, which Rob really wanted to ask you, but I'm all passionate now and he's kind of afraid. I know, see, he moves. He moves. When I really get going, he's like, ooh, that's a lot of energy right there.
It's prevention.
It is, it's risk management. The hands get going, it's kind of scary. But instead of looking at health as the absence of disease, how do we look at health as that vitality, that energy, that healthy, staying healthy? How do we really do that? Well, that's the process. So health trend management is that health strategy. Again, it's about looking at the economics. It's about increasing shareholder value. Does that sentence make anybody else nauseous? Am I alone? Does that not irritate you? Workers' comp people? Come on, people, work with me. Shareholder value. I'm like, are you kidding me? Shareholder value? But at the end of the day, it is about shareholder value. And we've reached that point where we've got to do something. I don't even care what kind of baby step it is. Because we need to be able to decrease their costs and increase that productivity. That's part of the process. And we do that through healthcare. Now, here's the big thing. While we made strides in creating separate cultures of safety and wellness, right? They're all separate and siloed. The two have yet to meet and merge in a sustainable way to create that culture of health. But I'm telling you what, you guys, we are on that little tipping point. We are really getting to that point. 10, 15 years ago, how many people have a Fitbit or a Fuel Band or anybody? Right? Did you have one 10 years ago? Very important steps of energy. It takes a systematic approach. It takes engagement. It takes commitment. And there are certain things that have to occur. The right tools being a big piece of that. And how do we get along? Well, organizational leadership. Anybody familiar with applied materials? Anybody familiar with Pitney Bowes? Anybody familiar with Nike? How about AT&T? Do you think for 1 minute or 1 second that their leadership isn't dead on the money when it comes to health and wellness? They're thinking, Nike, health and wellness. Not sure. Don't know if that works out all right for them, but they do. It's about having the right tools. So when we talk about solutions, we have to talk about the 4 aspects of what that is. Predictive analytics are the first piece. Predictive analytics, you have the best example for that. Predictive analytics, I never tell the story as good as he does. If I told you your house...
Yeah, your living room is going to be on fire tomorrow afternoon at 3 p.m. Knowing that today, or what are you going to do today knowing that relative to the cost and the damage that could be done tomorrow? What are you going to do? Oh, by the way, it's that old lamp that you love that has a short in the wire that's the problem.
What are you going to do?
Fix the lamp.
Fix the lamp.
Not being I need a new house, and so I'm going to go ahead and work with that.
Yeah, the insurance company's going to pay for it anyway.
The insurance company handles it all the time. So we have predictive analytics, which means I have the ability to tell you, almost to the T, what's going to happen to you in a predictive way based on your history, all your biometrics, all your stuff. And I'm not your employer. I am that third party. I can tell you what's going to happen to you. Does that scare anybody a little bit? No. Good for you. It scares me to death. You know why? Because my parents should have never had me. Why? Because genetically, I'm a mess. And I know that for a fact. And predictively, I know that I probably am going to die soon. No, I'm just kidding. Why? Because I knew it. And so I'm taking action to prevent that from happening. The second piece is being able to communicate the risk. We talk about privacy. Being able to communicate what that risk looks like. Teresa, we know you have a 92% chance of having heart failure at 50. Really? Yeah, sorry. What you gonna do? Who are you gonna get help from? The third piece is actually assisting the employer in accepting the concept that they have people to take care of, and lastly, having that personal involvement, that personal health record. What are we going to do? How are we going to do it? Because would you not love, hey, how many people, let me give you a scenario. How many kids? Do we still have kids? Are we at the age where we still have kids at home where we need to do the immunization stuff?
Yes.
Would you not love to be able to go into a personal health record and print it off just like that?
Yeah.
Right, you don't have to hunt for it, look for it, find it, can't you? How many of us have aging parents? Some of us even have dependent parents on their actual insurance. What a trip that is. It's like having a baby all over again. And how do I not love being able to go in, print this for the specialist that mom has to go see, all in one space, all together. So that personal engagement analytics. We want to talk just for a second about the claims analytics and the predictive modeling. Now, I know everyone hears the words and they think, oh yeah, whatever. You're going to try to tell me how much my claim is going to cost. Well, yeah, because I kind of know. But more importantly, I want to tell you what could possibly happen to you. So as I put together your claims data, and as I put together your health record, and as I put together your lab results, those biometrics, does anybody do those? Biometrics, where they come and just take a little blood and do the little analysis. I'm going to put all that data together. And on an average, it's hard to see probably. The predicted is the black line, which you can't really see because it's covered by the actual, which is the little pink line. You got it? This is no joke, folks. This is where science has gone. I can tell you what your percentage of having a stroke is based on all your data. I can tell you based on your lifestyle what kinds of things are modifiable and what aren't. It's scary, but it's also powerful. Because if I can know the risk, if I can identify the risk, I look to my loss control person, what can I do?
Prevent it.
I can prevent it. So this you can't really see either, but this is a chronic disease risk summary report. I want you to hone in on this middle section, which is really hard, but these are the different conditions this person has a percentage to get. Now this gal is Sally. You can't see this, I apologize. I'm trying to get a better copy, but not yet. Sally's a 57-year-old African American. These are all her biometrics, and these are her results. Now, here's the kicker. Sally has a 74% chance of actually getting a disease for CHD. She has a 77% chance of increasing for stroke. But you know what the real kicker about all that is? It's modifiable. That 77% chance of her having a stroke, she actually gets to have control over that. Why do I know that? Predictive analytics. Who knows that? He does. I say he because he gets to represent all the health people. He gets to know that. Not me, not my employer, but he does. I have smoking. Look, smoking. If I eliminated this, what did I just do to this number? Dropped it. If I get rid of smoking in this for stroke, what did I do to the number? Dropped it. What about exercise? Exercise for lung cancer? I dropped it. Do you see? They're small pieces. Exercise is a piece of it. But weight loss, cholesterol, blood pressure, those are all pieces. Now on work comp, do we care? Do we care about that? Why? Why do we care? Remember Joe Lunchbucket? He has all those different places to go. One of the aspects that help Joe Lunchbucket be better at what he does is being able to put all that data into a single platform. Being able to put all that data into a personal healthcare record. Love that? It's kind of like having all your email in one spot. Outlook does that. It pulls your email from Gmail and Yahoo and all over the place and pulls it into one place. Don't you find that convenient? It's the same type of data where I can actually pull all my weight management, my family health management, my social networking. All of this data flow comes in from all of these disparate data sources. How many different places do you have medical records? Think about that for a second. How many of us have moved? Different states, right? They're all over the place. What about mom? Mom's got records like you can't believe. But I can have them all in one place and all in an open interface, and I get to control all of that. Would you do it? Would you want it? If you could have it, would it help you? Now I get, trust me, I'm on this journey. And like I said, those of you who know me, this is a hard journey to run. It's not always about good engagement, right? You have good times, you have bad times, but it is about engagement. So it all starts once you know the problem. If you know that you're going to have a stroke, would you do something about it? Developing that wellness culture, that begins with evaluating the past to uncover what those modifiable risks are. We all know what our modifiable risks are, don't we? I have all those ability to put all of that stuff into one personal record. I have the ability to have control and passion around that control. And then I'm able to take that third party, then I'm able to take that third, is that my time up? Is my time up? Am I over my time? Ding, 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 I'm waiting for the hook, right? I'm able to take that information and I'm able to do something with it. And I'm going to be able to create data for you and your client. I'm going to be able to create data, not by name, by statistic. Just like we did with return to work. I can prove to you that return to work paid off. Our employers paid less for workers' comp. Not because of the employees, but because we made a change in how they came back to work. We did that. So what's the program real success? It's that balancing act. It's that balancing between the consumers, between the injured workers, between the physicians, between that employer or that sponsored plan. That balance between all those aspects. Because right now, guys, we don't have the balance. We really don't. We, the workers' compensation people, we end up with the short end of the stick. When they're not doing their part, sorry, I'm really picking on you today. When they're not doing their part, we end up with the short end. I'm going to put him on the mic because he's really soft-spoken, but it'll allow you guys to kind of come back down and relax a little bit. But I want to give, if you would be so kind as to give the example for Lourdes, but I really do want you to.
This is a real life case that illustrates a lot of what we're talking about when you do create that balance and can affect your healthcare spend. In this case, it's a hospital up in the Tri-Cities area. And effectively, relative to the claims analytics that they did, the biometric analytics that they did, the health risk assessment that they did. And keep in mind, most health risk assessment tools on the market today are what we call mortality-based tools. There's some derivative of the Framingham study that allows you to tell how long you're going to live, or if you do this, you'll live a little bit longer. If you do that, you won't live so long, whatever. But what we really need to start measuring, and this is helps us step together in what Teresa's talking about, is that study that she went through is a comorbidity-based or morbidity-based health risk tool that shows what is the likelihood of the onset of a diseased state. And that's what really is costing our system money, are those chronic conditions. The person didn't die, they now live, but they have very expensive medical costs. And culturally, we're faced with that issue, that the things that go wrong over time, BMI, cholesterol, glucose levels, they're stealth in nature. I don't necessarily feel bad while my numbers are slowly but surely creeping off the chart. So creating that personal health record that helps the individual track their trending is the key. If my cholesterol is 50 this year, it's 105 next year, it's all within the normal range, but if I connect the dots, the trend line is not so good. So that's what we're talking about doing. So implementing this kind of a program at a hospital of about 600 employees, we had these kind of results.
What?
Yeah, next slide. So again, it's a little bit hard to see, but the top line here was what their projected cost during that period of time would have been. This was the national average of increase in medical spend, and the green line represents the actual results in a hospital setting, which typically has very high claims compared to the rest of the population. So the point being is this stuff really can work, and there are challenges, and a lot of what we face in terms of the problems are cultural. People don't know what they don't know. So, and I've learned the hard way that culture will trump my logic every time.